Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. If you follow our channel, you know I'm a cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here, and I don't do boobs, bellies, and butts. I hope you will watch and subscribe to our channel. I like to answer questions that I get on YouTube. And one question was, can I do just a neck lift? Now, the nomenclature of facelift surgery is extremely confusing, and now with social media it's even more confusing because you have all these magic lifts and all this misinformation out there. So a traditional facelift, all right, is when you make incisions in front of and behind the ear, and usually down here, and you're lifting the deep layer, which is the SMAS, and you're lifting the skin. And that addresses really everything from here to here, all right? And it doesn't really do anything in the center of the face. So if you watch my other videos, I will expound on that. So some people will come in and they'll say, well, I have this, but I don't really care about this, so can we just do a neck lift? You know, the answer to that is not usually, and matter of fact, hardly ever, okay? And I'll tell you why. It's almost like if you have a four-door car and you're just painting two doors, okay? It just really never looks right or never looks balanced. In my career, and I've done over 1,400 facelifts, and we have, I think, one of the larger facelift practices on the East Coast, there have been a couple patients that really just didn't have much upper facial aging, and I might have done an isolated neck lift or a mini lift. But in general, okay, if you have this kind of stuff and this kind of stuff, and unfortunately I'm a good example, you need to address it comprehensively. And it sounds really attractive when you go to some of these websites or you hear people market and they say, oh, this is the mini lift and the magic lift and this lift and that lift. And I'm always skeptical about lifts that have a name, okay? Because a facelift is a facelift. And having said that, everybody does it a little bit different. And it's the operator, not the operation. So we all do what we feel is safe and effective, and the techniques that we have developed over the years. So by and large, your average patient that is from their late 40s on up is probably not going to be a candidate for some type of isolated lift. And just let me tell you this, you know, I do at least 3 facelifts a week, and any busy facelift surgeon will tell you that, you know, it's kind of an intense surgery because you're close up and it's very precise, and part of it's like doing needlepoint. And I really enjoy it. But if there was a device or some easy procedure that was going to give you the same safe and natural results as a facelift, nobody would do a facelift, okay? So I'm not a proponent or a fan of these isolated procedures, and I think that so frequently I see people that did that and they were really shortchanged. They got half a procedure and they got half a result that lasted half as long. I'm going to show you some pictures of some surgery we do, and thank you so much for your time. Stay tuned here. I'm Dr. Joe Niamtu, LoveThatFace.com. Now we're going to look at some before and after facelift cases that I've done. And this is a lady we did a facelift and a chin implant. So you can see we've really rejuvenated her face and neck. This is a patient with a much bigger facelift and has this extra skin and jowling, or this turkey waddle, and you can see how we have improved all of this, yet still kept an age-appropriate rejuvenation, which is important. The goal is not to make a 60-year-old look like they're 30. It's to make them look the best that they can for their age. And when you see people trying to push that too far, that's when people look fake and over-tightened and over-pulled. And this is the patient that I just showed you. This is her before, and this is her after. So you can see how nice her scars are. And I really have studied this hard and tried to do everything I can to perfect a predictable outcome for scars. And I'm really proud of the scars that I get. That's before surgery, that's after surgery. So really an imperceptible scar. Here's another patient with similar type aging. So we have this jowling and all this extra neck skin. And after the surgery, we have a nice rejuvenated neck and straight jawline without that big jowl. And again, this is that patient's before and after. So this is only 2 months. This is before, this is 2 months after. And the patient was from out of town, so she happened to stop in. You can see her scars are still a little bit red. Before is here, after is here. But those are going to blend in and do well. I usually wait at least 3 months before taking my after pictures. But I see so many out of town patients that a lot of times I'm lucky just to get an after picture. Another patient who had just excessive skin and fat buildup, and on people like this, you can remove that skin and liposuction that fat and really have a nice rejuvenation and a great result where you've gotten rid of this jowl and you've gotten rid of this turkey gobbler type neck skin. And this is the before and after of the scars of this patient. That's before, this is after, this is before, this is after. Here's a patient I did cheek implants and facelift, and I think we did laser resurfacing. And again, we're looking at this jowl. You can see the improvement, this loose neck skin. And this is really the rewarding part of my job. I mean, I just love being able to make somebody look and feel better. It's just a great skill set. I'm so lucky that I have this kind of job. Here's another patient. And again, this patient's in her mid 50s, but she's just got this hereditary neck skin. The rest of her doesn't look that old. I think we did lower eyelids and I did cheek implants, which make a big difference in helping to make that upside down egg, make that face look more youthful, and of course, tighten her neck with the facelift. Another patient, just a lot of hereditary excess skin, and we did a chin implant to help her. So we increased her chin length, we tightened her neck skin, and got rid of these really big jowls that she had. You can see her after scar there, still a little bit pink, but really will heal well. Another patient who just had a lot of jowling and a lot of neck skin before and after. I did her upper and lower eyelids as well. Male patients, this is before. This patient had quite a lot of extra skin, and you can see the difference after the surgery, and you can see that the scar is really imperceptible here. Another male patient that we did face and neck lift on. So, as I stated, I have a passion for education. I teach courses at my office and have international attendance, and it's really great to meet cosmetic doctors from all over the world. I have an online video series that doctors can download and teaching the various procedures that we do. And also, I already mentioned my textbook. So I'm really involved in academics. I guess I'm kind of nerdy because cosmetic surgery is pretty much my life force and my drive. This is some of our courses where we lecture and teach. And, I'm giving this lecture here. This is August 2020, and we're right in the middle of this COVID crisis. One of the things that I really miss is speaking at meetings and conferences. And I've spoken on 6 continents and usually speak all over the world. And right now, it's all virtual. It's all Zoom. So I miss that. So, in any event, I hope you enjoyed this presentation, and I hope that my excitement and passion for facelift surgery is obvious. I'm Dr. Joe Niamtu in Richmond, Virginia. My website is lovethatface.com. Our phone number is here, and thank you so much for your time.